Okay, thank you. Thank you again. Good morning. We are so thrilled to have you all here joining us this morning for our very first webinar in our new quarterly webinar series that is hosted by the Center for Native American Cancer Health Equity. In just a bit, I'll provide you with a bit more information about who we are. But this morning, we are very delighted to have Dr. Dornell Pete, who is a postdoctoral research fellow in the epidemiology department at Fred Hutchinson Cancer Center in Seattle. And the topic of today's webinar will be building tribal cancer research to address stomach cancer. And before we get into her presentation, I will just allow us some time here to quickly just set our intentions, because this webinar series is intended for Native American college and university students primarily, but is open to anybody with an interest in the presentation topic. I just want to prime you all from a Native cultural standpoint. It is our practice that anytime that we are talking about something as intricate as that has a lot of weight to it, such as topics of cancer and cancer health, there's a lot of intention that should be going into why we are here, what is our purpose in talking about it. So with this said, I just want to give you maybe up to 20 seconds, 30 seconds to just, if you need to pray, and let the Creator, let the spiritual beings know what your purpose here is today. And we'll set the tone off right in that way. Okay, so thank you for participating in that intentional space setting. I will now move us forward. So this new webinar series hosted by the Center for Native American Cancer Health Equity is overall, we are located at Northern Arizona University in what is now known as Flagstaff, Arizona. And here you see a beautiful photograph of our campus. First, in the focal viewpoint of this photograph, you'll see our Native American Cultural Center there, front and center. And we do have our sacred mountain there in the background. Very briefly, who are we as C-NACHE, or the Center for Native American Cancer Health Equity? We are a fairly newly funded center that was established in December of 2022. And we're very fortunate to be awarded a grant from the American Cancer Society to Northern Arizona. And our overall goal here is to reduce the unequal burden of cancer and to also advance cancer health equity for Native Americans here regionally, with a focal point on Arizona and also the broader Four Corners region. And we are particularly looking at improving, instilling positive systems level changes to improve cancer screening rates for Native Americans, to improve access to cancer care services, and to also address the exposure to cancer-causing environmental contaminants in Native American communities. And so the intention of this new quarterly webinar series here is we are committed to spotlighting the different types and aspects of cancer research occurring throughout Turtle Island, or with a particular focus on the Four Corners region, and research that is addressing the impact and prevalence of cancer within Native American communities. We are also striving to demonstrate how diverse fields of knowledge can also contribute to cancer research, from areas like social and behavioral sciences to biological sciences, even liberal arts and those studies as well, and beyond. So oftentimes when somebody hears the word cancer research, we automatically think like, oh, bench science, chemistry, biology, microbiology. But we do want to emphasize the importance that all of our disciplines hold a lot of weight and hold a lot of value. And I think together we can see multiple perspectives of how to address these cancer issues that are impacting Native American communities. So stronger together. And this series aims to inspire and educate the next multidisciplinary generation of cancer researchers and advocates within Native American communities. So with that, I am now going to hand it over to Dr. Dornell Pete, and she will be sharing, we will be transitioning right here with our slides. So thank you so much.
Well, thank you, Carm, for that introduction. Can you all hear me okay? Just a thumbs up if you do. Good. Okay, thank you. I have to minimize here. All right, well, thank you for this opportunity to share a little bit about my research, but also about myself. So for my relatives in the audience, I also want to introduce myself in Navajo. She'e Dornell Pete, Yanenshia, Tohe Glini, and Shlanta Baha Bashishchin, Tensakati Shiche, Lizithlana Chanela, She'e Denen Nishle. So as it's been seen on the flyers here. I am a tribal member of the Navajo Nation. I have also been a guest to these sacred tribal Pacific Northwest tribal lands here with my partner and our dog and our cat for about 7 years now, which also known as Seattle, Washington. I'm very excited, again, to share my work in addressing stomach cancer disparities in American Indian people, but particularly at the tribal level. So for my talk today, I will share a little bit about my prior tribal cancer work. I'll go then into describing stomach cancer disparities in Native people as well as Navajo people. And I'll also talk a little bit about my research program. While I have 4 studies that have shaped my research program, I'll only discuss one study, which is this, which was foundational for my other studies for this talk, which is prevalence and correlates of H. pylori. And then I'll end with some final thoughts about my journey that has got me this far. So I know some folks here. I saw some familiar names on the Zoom webinar here. But for those that I have not crossed paths with, I'd like to share a little bit about me. So I was born and raised in the northeast part of the Navajo Nation in the town of Shiprock, New Mexico. So growing up in Shiprock, you either did 2 things. You either played basketball or you worked on the farm. And I did both of those things. So by age 10, I was driving a tractor and helping my grandparents harvest crops. And that was a real great experience I had growing up. And I wouldn't trade that for the world. And I'm very thankful to have been raised on our tribal homelands. Also, the community I grew up in really taught me to be resilient through the ups and downs of living the reservation life. You obviously see the differences when you drive off the reservation, the disparities, the problems, but it really taught me to be resilient. And at the same time, I was really, really blessed to be raised by my amazing mom, who was a former preschool teacher, my 2 older sisters, my grandparents, and all my crazy aunts and uncles. And despite being a little unique growing up, a little different, my family has been really accepting of me, of who I am, and as I identify as part of the LGBT community. So I also want to share my main motivation behind my work. So from an early age, I witnessed my grandparents, who were the pillars of our family, deal with cancer. My grandparents were both diagnosed with lung cancer, even though they never smoked cigarettes in their life. And doctors told my grandparents that they got lung cancer from the uranium mines where my grandfather worked for decades. So during World War II, as some of you already know, mining companies really took advantage of the resources and labor across the Navajo Nation to provide uranium for the US military. And many Navajos, including my grandfather, worked in these mines without protective equipment. So also there was no real cancer treatment offered to my grandparents. This is the interesting thing too, is that, you know, my grandfather worked in the mines. He obviously had this occupational exposure. But when he came home, my grandmother, we didn't have running water, but they lived near a stream. So she washed his clothes and she therefore got exposed to the dust particles in that respect. And that's how she herself, uh, developed lung cancer. But they were really not offered any real cancer treatment after their diagnosis, except for the management of pain and symptoms. And of course, at that time too, there was also very limited culturally relevant healthcare. And our family at that time was really concerned about the high healthcare costs and really just navigating the system to, what is involved with, their cancer diagnosis. So this experience, unfortunately, is not new to families in the Navajo Nation. Uranium exposure and its contaminants remain an important environmental health issue today. So overall, my family, my lived experience that I just shared, really motivated me to make a positive impact on the health of Native people. So I also want to provide, my academic professional background very briefly. So early on in my career, I earned my bachelor's degree in biochemistry because I thought I wanted to work in the lab. So I worked as a chemist for my tribe's utility company, which is some of you know, the Navajo Tribal Utility Authority. And as a chemist, I was analyzing drinking water, water samples that from the systems that provided water to the tribal communities to look for harmful contaminants. And that really exposed me to some of the issues surrounding drinking water for the Navajo people. And that really struck my interest in how, environment affects health. So that got me interested in public health. And I returned to school in 2006 to study environmental health, as well as epidemiology at the Yale School of Public Health. So I was there for 2 years, gained really good training and education. After I graduated and earning my Master's of Public Health degree, I came back to the Southwest and specifically started working with the Navajo Epidemiology Center. And ever since then, for about 15 years, I've really worked as an epidemiologist with tribal communities during this time frame. So a lot of this, applying the work that I was doing really made me realize that there were a lot of people who were sitting at the decision tables weren't representative of me. They didn't look like me. They didn't grow up on the res. So that really, I wanted to be in that position to be able to, make decisions for tribal communities, but also to lead our own studies. So that really motivated me to go back to school. So in 2017 is when I went back for, a PhD in epidemiology at the University of Washington here in Seattle. So in 2022, I earned my PhD in epidemiology. And then at the same time, right after 2 months after I graduated, I started my postdoc research training at the Fred Hutchinson Cancer Center, which is down the road from the University of Washington. So this just kind of gives you, the trajectory of my, my academic, my career, And really since 2006, my career has focused on practicing epidemiology and public health, as well as research with diverse tribal communities. So I got into cancer research while working as an epidemiologist at 3 tribal epidemiology centers, or what we call the TECs. So my work had the aim of building and supporting tribal data sovereignty. And I've been doing this work, as I mentioned already, for over 15 years. And for folks who are not familiar with the TECs, there are 12 tribal epidemiology centers across the US, and they're color coded here to show their service areas. And these centers really work to understand the health of rural and urban American Indian and Alaskan Native people in these areas. So I really want to walk briefly through the different TECs that I worked with. So at the Navajo Epidemiology Center, which is housed at Window Rock, Arizona, I accessed and utilized cancer data to write cancer reports for the Navajo Nation to understand our cancer disease patterns. And really from this work, we are really turning this data into action. So we're drafting a cancer control plan right now to strategize how to address cancer in the Navajo Nation. And we're currently also working to develop a cancer data dashboard to help disseminate cancer data that we've created, that we've gathered and looked at in these reports to share back with the community. So this data dashboard hopefully can be launched in sometime this year or in the next few months. So I also work with over a dozen tribal tribes in New Mexico, Colorado, and Texas to collect tribal specific health data at the Albuquerque area Southwest Tribal Epidemiology Center. So, and this was important because if you didn't know, tribe specific data is very hard to get. So the tribes in the states I just mentioned really wanted their own data. So in this role as an epidemiologist, I worked with the tribes one-on-one to design questionnaires, administer the survey in the community, collect and analyze the data, and share results back with the community, like in reports or presentations. So this work was really important in that regard of like building tribal data sovereignty and giving data that's back to them, that's relevant to them. So also from this work, we found out that conducting surveys in person with rural tribal community works so much better than conducting surveys by telephone or phone, which is often done at, at the state health departments or even national programs, health programs. So I also work with the Urban Indian Health Institute here in Seattle while I was pursuing my PhD, because I had to hustle and earning additional money while I was in school. So this was an opportunity also to give back to tribal communities, because when you're in school, you get disconnected from your people and your community. So I use my data and epi skills to produce health reports to understand health and cancer disparities in urban residing American Indian Alaska Native populations across the US. So if you didn't know, the work at the Urban Indian Health Institute, or UIHI, is really important because about 70% of Native people live in urban areas or off their reservations. And this map just shows you the urban Native centers across the US that UIHI serves. So today I really stay connected with these tribal epidemiology centers, and I continue to improve cancer data, which helps inform cancer control policies. And for Native people participating, also I participate on multiple tribal and national data work groups to help, nationally, how do we improve, data, cancer data for Native people. So all of my prior tribal cancer work group really just allowed me to understand cancer disparities, but also allowed me to focus on my own research interests in stomach cancer in Native people. So the incidence, this is some background information about stomach cancer. So the incidence are new cases of stomach cancer is declining for the overall American Indian Alaska Native population. However, these disparities among certain regions of the US, particularly, thinking about the Southwest area, gastric cancer disparity still really exists in the Southwest. So this is still important. This is a 2020 paper that we did. And for the Navajo Nation, if we look at the stomach cancer rates, the incidence of stomach cancer is almost 3 times higher, and mortality is over 4 times higher compared to the Arizona and New Mexico white population that surrounds the Navajo, the county level information of the white people compared to Navajo people. So in the tribal cancer report that we just produced the end of last year really shows this continued disparity over time. So why might stomach cancer rates be high in the Navajo Nation? So we can think about the risk factors for stomach cancer. So there are different risk factors by the site of the cancer, particularly gastric adenocarcinomas here. Cancers in the upper part of the stomach are called the cardia subtype gastric cancers, and they are associated with risk factors related to obesity and GERD. Cancers in the lower part of the stomach are called the non-cardia subtypes, and they are associated with Helicobacter pylori infection, diet, behavioral factors, and having a family history of stomach cancer. And based on our 2020 paper, American Indian people, Alaska Native people had a greater prevalence of the non-cardia subtype of stomach cancer. And this really led me to focus on studying Helicobacter pylori infection as a contributing factor to the high burden of stomach cancer in the Navajo people. So what is Helicobacter pylori, or H. pylori? It is known to be a strong risk factor for stomach cancer, as I mentioned. It is a helical-shaped bacterium seen in this photo here. It resides in the mucus layer of the lower parts of the stomach, and it's often acquired in childhood and from an infected person. And people who get this infection, about 10 to 20% of those folks will develop stomach ulcers. And people who have a long chronic infection with H. pylori, about less than 1% of folks will develop stomach cancer. But just having this particular bacteria doesn't put you on the path to stomach cancer. There are other factors that contribute to these different disease development, like a person's genetic makeup, their immune response to this infection, as well as there are different strains of H. pylori that are more harmful that, it's really hard to get rid of, or it really can create more harm in terms of the environment in the stomach. There are also individual factors like a person's diet, their behavioral factors, and just kind of where they're living, like close environments to be able to spread or have the same behavioral factors within their home setting. So these are some information about disease development from H. pylori. And if we look at statistics of H. pylori in Native people, the H. pylori, based on what's been published in the literature, H. pylori is found to be in Alaska Native people, about 75% in several studies looking at different Alaska populations, Alaska Native populations, which is quite high. And then in the natives in the Plains region, H. pylori was found to be around 55%, the H. pylori prevalence. Right now, there are no H. pylori prevalence statistics like comprehensively if we think about regions and Native people here in the Pacific Coast, really the Southwest, but we're getting there, the East, as well as in urban areas. So therefore, just to talk about my research program, my research really strives to use community engaged approaches to understand H. pylori infection in Native people. And I'm also implementing this program at the tribal level with the Navajo Nation. So my studies really intersect with lifestyle factors, environmental factors, social demographic factors, treatment and healthcare, as well as the gut microbiome. So these areas touch on many fields, which Carm mentioned early on, which is important, I think is important for cancer research, and which I have used. So, the fields of cancer biology, epidemiology, environmental health, the healthcare system itself and treatment, prevention, maybe even looking at policies and interventions, as well as math in terms of statistics and biostatistics. And I think often we forget too, if we think about more of the liberal arts area, but I really don't think it's liberal arts, but I think it's just ourselves as Native people. I think this is very important, our indigenous knowledge systems. And this is very important in the context of our work, of my work certainly, and how the community is important to be engaged in this research. So I'm going to discuss my foundational pilot study on determining the prevalence and determinants of H. pylori infection in adults from the Navajo Nation. So this study to me was really important because it was addressing a cancer disparity in Navajo Nation, as well as nationally, and it informs cancer prevention strategies. This, by collecting this data, that was my goal, that it would be we can identify strategies for prevention. So as many of you know, community engaged research with American Indian communities takes time. So in the Navajo Nation, I met with many community members and health providers. I addressed their questions, got their input and support for this study, and I completed the tribal IRB applications. I submitted the data back to the tribe after this study was done, because the Navajo Nation Human Research Review Board requires that the data go back to the tribe. So this whole study of community engagement took about 4 years to complete. I'm still in the process of sharing information with the community. So just to share a little bit about this study, so I conducted a cross-sectional study, which I call the Navajo ABID study. So the ABID is the Navajo word for stomach. And I did this study from January to November in 2021, and I did it in 2 areas of the Navajo Nation. And I really selected these areas because, as we know, with the great folks at NAU were focusing on Western Navajo. So I was focusing on more of the eastern part of Navajo Nation. So just to describe some of the methods that I implemented. So the participation of participants was really done remotely, because when I implemented this study, it was during COVID. So I use online and offline platforms like my website, social media, to get people to learn about the study and do participant recruitment. And then when things opened up, I worked with outreach workers to post flyers, host events and flea markets on Navajo Nation, as well as advertise in the tribal newspapers to really get people to learn about the study or hear about the study. So participants decided to participate. They reached out to me. I went through the study. I consented them into the study. And for people that were eligible and consented, I mailed them a kit that included the questionnaires. They had to submit a stool sample. So I submitted everything in this packet for them to complete at their own time. And then when they did, they mailed everything back to me and the sample went to the lab here at Fred Hutch Cancer Center. And then once everything was received, the participants received a $50 gift card for their participation. So the data that we collected really came from, lab analyses and the questionnaires. As I mentioned, stool samples were collected from participants where they were analyzed with droplet digital PCR for H. pylori. And the questionnaires provided information about demographic factors, health conditions, behaviors, environmental factors, and food consumption. And these questionnaires were available in English and Navajo, and Dr. Priscilla Sanderson and Mr. Frank Morgan were really instrumental in allowing me to translate this information in Navajo, and that the questions I'm asking were culturally relevant. So that was our data. Now, if we look at our data that we've collected, so if we look at our results, so for the 99 participants with complete absolute data, the majority of participants were in the 36 to 45-year-old age range. They were female, and most had a greater than high school education. And of the 99 study participants, again, we found that 57% were infected with H. pylori. And if we think about this, this is quite high. And compared to what's been published in the literature of US non-Hispanic white people, our prevalence was almost 3 times higher than the white population in this prevalence. So this really shows us a high H. pylori prevalence has been found among study participants of this study. So I also looked at the associations of these different factors, like demographic factors, a person's age, their education, their health factors, a family history of stomach cancer, their smoking behaviors, if they were smokers, alcohol use, sodium intake, and type of water they consume. So all of these factors have been in the literature, have been associated in some way with H. pylori. But I found no statistical association, and it's probably because of the small sample size I had, but I found suggestive positive association. So people who smoked had a higher odds of having H. pylori, and people who had a high sodium daily intake had a suggested higher odds of H. pylori. So this is pretty interesting, but we overall no statistical associations. So in conclusions, we really have an increased understanding of the high burden of H. pylori infection in our study participants, and I've been working to increase community awareness of these findings and really get community input of these findings. We also found no associations, what I just shared, of risk factors in H. pylori infection. That just calls for larger studies that are maybe needed to help confirm our findings, or maybe we can detect associations, or maybe there are new factors that we didn't think about that we need to study more. So new hypotheses. So the cool thing about this work is really disseminating information back to community members. And I've done this with, community members, leaders, and providers in various ways. So for example, I've presented at community meetings and health program staff meetings. And really what's come out of these meetings from staff and community members is this request for health education information about H. pylori. What are the symptoms of H. pylori? How can I talk to my doctor about my symptoms or about H. pylori? And what are the ways I can prevent H. pylori infection? So I worked with colleagues here from the Indigenous Cancer Health Equity Program here at Fred Hutch to develop these cool fact sheets for the public to access and download from the study website. You can go to the website and check out these fact sheets if you like. So I also shared these findings at provider grand rounds and webinars in the Navajo Nation, and this has really stimulated conversation about thinking about the policies they have within, say, for example, the Indian Health Service. And they're talking about how can we improve H. pylori care. So the thing that's coming up, which is really interesting, is providers follow guidelines nationally for H. pylori care. But if we think about it, the prevalence of H. pylori nationally is much lower. We saw that bar graph, it was like 20%, maybe even less than that. So these guidelines are based on a low prevalence H. pylori setting, but someplace like Navajo Nation where we have high H. pylori prevalence, maybe we need to adapt these policies. So this is something that's being discussed right now, and just interesting discussions with this. I've also met with our traditional healers at the Dene Association. And the meetings that I had with them were really insightful because they really shared and drilled down that Navajo people should have the opportunity to have both Western and traditional healings during this process of thinking about H. pylori or stomach health. So they really drove home that a Navajo person will need to be cared for as a whole person. So there are matters, for example, in a person's life that could be discussed in addition to their stomach health issues, kind of to bring more of that healing and closure, or yeah, really much healing. They also shared that they really confirmed that our diets indeed have changed, and they were themselves eating donuts and coffee, and they were saying this and they were laughing. But they also too mentioned that we have herbalists who know medicines that come from our land that may help in these situations. So that was really insightful meeting with them. So all of this first study allowed me to grow my research in different areas of studying H. pylori. So I have currently 3 more studies going on to look at improving H. pylori infection treatment, because if you have H. pylori, there is treatment available for you to get rid of this infection. But this treatment is really hard to complete. So I'm doing right now, really gaining people's voices and stories about their experience with treatment. How can we improve it? So I'm recruiting participants right now from across the nation. So reach out to me if you're interested. I'm also looking at reinfection. So when people take treatment, they clear their infection, right? But they go back into their home setting, they get reinfected. So is something going on that we can learn about reinfection that we can also help intervene on? So I'm using clinical data from Navajo Area IHS to do this study. I'm also interested in looking at the impacts of H. pylori on the gut microbiome. I don't know if you guys heard about that, the gut microbiome, but I'm looking at how does H. pylori impact the other bacteria that should be healthy in our gut system, and how does that impact? Does it get rid of them? Does it make other bacteria exist more? So this is something that I'm really interested in, and this is a study that's underway. So some final thoughts in reflecting on my journey. I think me going through the education system from different parts of the US, and these different settings, the odds are really stacked against us. The statistics say that Native students and researchers, about 17% of us earned a bachelor's degree. About less than 1% actually earn a doctoral professional degree. And now, as I'm moving into this academic field, about 0.3% of Native researchers like myself are awarded a National Institutes of Health grant. That is very low. So these odds are stacked against us. Yet, I think there are allies, there are mentors, there are, support systems that allow you to, beat the odds. So as I mentioned, my roots, this was me growing up in, very humble beginnings. And I was very fortunate to, graduate in 2022 with my doctorate degree and beat the odds. So I just want to leave you with this. So build your journey. And this is really by drawing strengths from your roots, where you come from, which has worked for me, and really exploring your passions. I thought I was going to work in a lab, but I found out I like working with people more than I do working with, flasks in a bench setting. Also using your talents and build off of that. I think we're all gifted with something, as well as your failures, because those things will teach you so much and actually give you more drive to keep going. Also defining your purpose and what you think that is, and just try it out and go for it. So I want to acknowledge all the folks who really made or make this research possible. And I'm grateful for the NIH NCI funding that I got, as well as the different pilot awards I was able to get, as well as my supportive family and friends. So yeah, thank you. I'm open to questions, and yeah.
Thank you so much, Dr. Pete, for all of the tremendous work that you're doing in this area. I like how you connect your story and your journey from, your grandparents and their experiences, and then combining all that knowledge from them and your community and your culture, and then building your Western understanding into that and bringing it together and doing, making all these movements in this area of knowledge around stomach cancer. So thank you again, and thank you for imparting us with those powerful last pieces of advice and guidance that we have for our students here this morning. I do want to open it up to the entire audience here today. Please unmute, or also feel welcome to turn on your cameras. We do want to see your lovely faces, and also kind of simulate that, sitting around in a circle and having discussions with our speaker here. I think, just letting her know that you're present with her and engaged, I think does a lot. And we know that when we're in our community circles, that is often what happens, is you need to be engaged and present with our speaker or our honoree. So thank you again. And at this point, we have about 10 minutes for questions and answers. So any burning questions, please feel free to, well, the first person is Kellen. I see your hand up. So thank you for joining, Kellen.
Hello, good morning, and thank you, Dr. Pete, Dornell. Long time no see. It's been a great pleasure and to know you and your work. But my question is, well, I do have a comment that I recently was diagnosed with H. pylori infection, and I went through the whole regimen of getting that diagnosed and getting the treatment. So I'd be interested in your study as far as that, but I'm not sure if it's just particularly for Navajo Nation citizens, or is it people that, because I received my care through the Winslow Indian Healthcare Center. So I'm not sure if that may be, I don't know if I were be eligible for that or not. But in any regard, I'd be willing to share my story with you and the community members in and around this area. The question is that with the H. pylori infection, and can you explain to us the treatment a little bit further detail as far as what is involved in that treatment, and what can be the kind of the ramifications with that?
Yeah. Well, I'm glad you got treated, Kellen, and you've completed the treatment. So the study, just to kind of bring that up, it's currently happening now, and I'm looking at people who reside on the Navajo Nation and who have used the Navajo healthcare system, and people who are diagnosed with H. pylori within the last 3 years and who took treatment or attempted to take treatment, and also identify as Navajo. So if you meet those eligibility criteria, then shoot me an email. Okay, so that's kind of that piece. So H. pylori treatment. So what I've learned with thinking about H. pylori in the Navajo Nation. So there are different treatment regimens available to treat H. pylori. So there's triple therapy, there's quadruple therapy, but it typically requires 2 antibiotics, different types of times of the day. So the morning, the evening, afternoon, and the type of medication you get depends on any allergies that you might have. Maybe even providers know what the susceptibility or effectiveness of these medications in terms of the antibiotics that are effective. They may prescribe more of that. So they have different options of antibiotics to prescribe to you based on that. Then you also get, so for triple therapy, that you'll get the proton pump inhibitor, which is another medication that brings down the pH levels so that antibiotics can be more effective in eradicating or getting rid of H. pylori. So that's something in triple therapy, is that's one line of standard therapy. Then there's quadruple therapy, which is the same concept, but they added this bismuth therapy feature, which is really much Pepto-Bismol, to make it more, feasible for you and tolerate this treatment. So what happens? What's the impact of that? So the good thing is if you complete it completely, the treatment, it eradicates it. That's good for you. And then, your stomach, your biome, your gut microbiome changes a bit based on the clearing out of the bad and the good bacteria. But it takes like some time for that flora of bacteria to kind of build back up, but it eventually goes back to your healthy kind of gut bacteria. But if you don't complete the treatment, the impact of that can really create resistance with this H. pylori, because some people say, oh, I took the medication, half of it, because I felt better. And I really just don't want the side effects. But what that introduces is this resistance. So it gives this little tease to the bacteria that thinks that, oh, it's trying to, get rid of me, but its genetic makeup is really unique. Fernando is on the call here, but it can really then adapt to that and then resist that treatment. So those are the impacts. I hope that answered your question.
No, it does. Thank you. And yes, I did have those types of signs and symptoms afterward. As far as my gut biome, I was had to take probiotics afterward. But yeah, thank you very much for that information. And again, study aside, I'm willing to share my story, so feel free to utilize me. I'll send you an email.
Thank you.
Great. We have a hand up from Curtis Briscoe.
Well, good morning, Dr. Pete. It's great to see you. I know you actually came down here and we talked about this project a little bit while you were getting it going, and I'm very excited to hear the results that you're getting, because I think this issue, this particular subject of H. pylori it's been here, but no one's really been pushing in terms of getting it in the forefront when it comes to prevention of gastric cancers. And so this is actually the second webinar I've been on this week. And I'm glad that you went to the northern, to the Mexico side, because the one I was on Tuesday talked about Winslow into the city a little bit. So it was great to see a broader approach across Navajo. And there's three things. One, in terms of getting cancer data, and we've talked about this before in Cancer Group, is of course misclassification of American Indians when it comes to what the specific diagnosis is for that race. That's always an issue. And I know Arizona Cancer Registry does a great job of cleaning that up as much as possible. And so I don't know if that affects your national data too, meaning that AN are actually being underreported in terms of a percentage compared to non-Hispanic whites across the country. So I wanted to kind of mention that. The main two things I wanted to bring up, I'm trying to bring both of these kind of talks together. And I was very interested in the demographic breakdown that you had in terms of having 73% of your participants women, and then you had 57% of those with H. pylori infections, which was extremely higher than the other group, was that comparative group that was lower. And the other, and I wanted to add, this is the first question is, did you look at this study in terms of gender? Because it was mentioned in the previous Tuesday webinar that a higher percentage of women were, compared to men, were diagnosed or had higher incidence of gastric cancer vis-a-vis H. pylori. And so I wanted to kind of put that on the table because that was, you're kind of in that same area too. So I'm just wondering if it's a gender thing between Navajo men and Navajo women, and I'm not sure what that would be in terms of that. And the other thing that was really interesting that I wanted to ask about your study was the thought of the environment. I think that's really because, I think that's really the one thing in this whole two parts that really has been eye-opening is it something in the environment on Navajo or in the region that could potentially be the thing that has created a lot more infections related to H. pylori. And the one thing that I wanted to ask, and I'm sure it's not something that you're sure of, but could it potentially be like in the water or something like that? So I just wanted to bring those up. Thank you.
Well, okay, Curtis, you're one of those very few folks who are on like boots on the ground, direct with our tribal members. I appreciate what you do, Curtis. So to answer very quickly some of your questions, and I agree. Like I think, when I started this project, I was thinking what's missing from what's been done with NAU and U of A, and I think it was focusing on Eastern Navajo. What would be great, and we kind of talked about it, but nothing's been really kind of solidified, is combining these data to get more power in terms, when I say power, more sample size to be able to do mathematically, statistically to detect some of these associations. So this is something that, is a possibility. There's potential there. The male and female differences. So I'm looking at some gastric cancer data analysis right now. So the thought is that gastric cancer should be higher in males. That's what the literature has pointed to. Studies have pointed to that. But as you say, Curtis, that maybe there's a shift happening here. I haven't quite seen that shift in the actual cancer data myself, but maybe on the clinical level where they're, direct patients, maybe, I don't know if the presentation was clinical that you heard. So maybe they're more of seeing that. But I would just caution with that, like who engages more with their health, male or female? What would you surmise? So probably females are more engaged with their health, going to their healthcare system and maybe being diagnosed and more engaged with their health to advocate for themselves. So maybe in the clinical setting, that's why the data might be looking different for females in that regard. But in the cancer data itself, it's showing more of the male. So that's a good question. Maybe that could be explored a little more. Also, the women who participated, this was a non-random convenient sample of folks. So, more women, it seems like to participate in studies, again, just be more engaged with their health than do men, in general. And I think that applies to Navajo men too, our Navajo identifying males. So that's probably a limitation too, in terms of those norms and kind of engage with their health. The environmental exposure, that is a great question. And this is what I got a lot when I returned the results back to the community. It's in our water, what's in our water. There hasn't been any formal, concrete, confirmative studies out there to show this relationship. with the water we drink and H. pylori. But I think it really plays a part, though, that having access to water really plays this sanitation factor piece. So, you know, washing your hands, being able to have running water, a sewage system connected to your household. So I think this water component is a big question mark. And based on what's on studies, the viability of H. pylori to exist and be transferred to a human and be viable, meaning livable for it to exist in your body, that's a big question mark. So this is another research direction that these studies could go, is like, could we just test the water? Is there a presence of H. pylori in our public water system? But I'll say the participants in my study, about almost close to 90% had running water. And the interesting thing, as we know, my parents do drink a lot of bottled water. They don't drink water from the tap. They get it from Walmart and all the cases of bottled water. So they drank more of the bottled water in terms of like drinking tap water. So that was the interesting thing that I found out from my study.
Really, really great questions that were posed there. Thank you so much for asking, and also Dornell for sharing. And at this time, I just want to start wrapping us up and closing us here, our time together. So again, thank you so much, Dornell Ehihetla, for all the knowledge and just the personal wisdom that you shared with us this morning in this session. So I do want to close by saying to you all, please take a moment, even now, if you can, share your feedback with us. We would love to know what we did well, what we can improve on, and possibly who we can even engage in the future. So you can either scan that QR code there or enter that URL, tinyurl.com address there in your phone or on your browser. But those are two ways for you to engage with us and let us know how we did on our quick evaluation survey. So with that, I'm going to wish you all a great day. I know we have a few other questions here burning, so I just want to send people on their way. I'll stop the recording soon, and then we can continue this on as long as Dr. Pete has some time. But thank you all again for joining us. Have a good day.
Thank you, Carm. I just want to share a few slides of the opportunities here at Fred Hutch Cancer